Well, welcome everybody. It's 7 o'clock. It's Monday. It's also Bank Holiday Monday in England and Wales, but not sadly in Scotland. But it's time for our Royal College of Surgeons of Edinburgh webinar, part of the COVID series. It's about our 50th, I think, of the series. But this today is very different. And it's the first of our joint webinars hosted by the Edinburgh College and the Royal College of Surgeons of England. And it's an absolute delight to welcome my co-president, Neil Mortensen, who's there.
Evening, everybody.
And lovely to have you here, Neil. And now we're talking today about climate change and what we as surgeons can do about it. And this is not just about education today, it's about learning from all of our members and fellows out there. So you please get in touch with us on the Q&A button and tell us about, oh, we've got an extra attendee there, Dave. So get in touch with us. And if you have ideas of what we should be doing or what we should not be doing, please get in touch. If you have questions, of course, for the panel, then please do that. So we've got a fabulous panel tonight. We've got David Riding, our trainee representative from the Royal College of Surgeons of Edinburgh, and we've got Vic Pegner, who hopefully is going to last today because she's not far off a due date for her third child. But Vic is the trainee member of council for the Royal College of Surgeons of England. And they are the future of surgery, and they have the future of the planet in their hands, and they are going to speak to us today about what the college is doing, in other words, getting our own houses in order, but also about what we can do as surgeons to make a difference. And we've also got Stella Vig, a celebrated advocate of training and consultant vascular surgeon and member of council from the Royal College of Surgeons of England. And we also have our celebrity guest, Richard Smith. Now, Richard is interesting because he qualified in medicine in Edinburgh, but he's now based in Clapham in London, so he's got a foot in both camps, I would say. But he was, for many years, the editor of the British Medical Journal, and now he's the chair of the NHS Alliance on climate change. And I'm delighted to say that both the Edinburgh College and the English College are members of that group. So Richard, you are very welcome, and thank you very much for giving up your evening of Bank Holiday Monday to take part in this important webinar. So I'll just going to show a couple of slides. Have you got those, Abby? If we pop those up. I just want to make a few very quick points about the footprint that surgeons have on the environment. Next slide, please. So what we do know is that operating rooms generate about a third of the total hospital waste from an institution. And a lot of that waste is a problem because it's usually contaminated by body fluids. And if it's contaminated by body fluids, it is not recyclable. But there's a huge amount of paper, cardboard, blue surgical equipment, etc., and plastics that really could be recycled better than we are doing. And the facts are that the World Health Organization estimate that up to 90% of healthcare waste is actually recyclable. Next slide, please. So just give you an example, this is the sort of waste we get from one laparoscopic cholecystectomy. Next slide, please. The waste from just simply one cataract. And next slide, please. And can you imagine what the waste is from an open heart operation? Next slide, please. So just to finish, the UK, from the healthcare sector, produces about 5% of greenhouse gas emissions in the United Kingdom, and over 60% of that comes from hospitals. In America, the healthcare sector up to 10%, and it's the second largest contributor to landfill. And in Australia, 7% of CO2 emissions come from the healthcare sector. And I leave you with that point that operating theatres a third of the NHS institution's waste. So I'm now going to hand over to David Riding, one of our future surgeons who has been put in charge of our working group at the Edinburgh College, to tell us a little bit about what the college is doing to get its house in order, but what else we can do to make a difference for sustainable surgery. So over to you, Dave.
Thank you, Mike. That's a really good introduction to this topic. And to be honest, it's such a huge topic that it is difficult to know where to begin with something like this, really. I think we're all conscious of climate change. It's in the media, but it's one of those things that perhaps we haven't given enough care and attention to as surgeons. You know, we're all very busy people trying to do the best for our patients, but it's not always easy to see the bigger picture when you've got a patient in front of you on the operating table. But the counter to that is that if we don't do it, then nobody else is going to do it. We have to sort our own house out before we, you know, can start thinking about how to advise other people. So as a college, when we started this work, what we thought was that we had to make sure that we improved our own environmental sustainability as an organisation. And that's not easy to do. But there are some things that we've done that I hope show a clear intent, and that there is a plan in place for what we can do in future. Next slide, please. So the way we kind of divided our work up as a committee was to look at our internal sustainability first. As I mentioned, we have to get our own house in order first, but we also need to think about our external sustainability. So how as surgeons can we ensure that our practice is environmentally sustainable? And we, as the Royal College of Surgeons of Edinburgh, have a duty to our members and fellows to advise them as how best they can organise their departments and their systems and their services so that the environmental sustainability is considered at every step along the way. And at the moment, there is a gap in the market. If I'm a clinical director, there isn't necessarily anything coming from the NHS or the colleges that clearly shows what you can do at a local level, and that's what our members and fellows need, really. So I'm going to discuss both those things and what our approach has been to this point. Next slide, please. So in terms of our own sustainability as an organisation, one of the main challenges we have is that we occupy a Grade 1 listed building in the centre of Edinburgh that was built in the early 19th century. So this is a photo of the building when during the coronation in 1902, which I'd say is quite an elaborate decoration for the building, and I'm not sure we'd do the same now, but this is still the same building we're in, and it has all the same features that it was designed to have nearly 200 years ago. And a lot of the part of the estate of the college is like that. And that presents a real challenge for us when we're thinking about environmental sustainability, because obviously we also have a duty to balance the books and ensure that, you know, that we're providing an adequate service for our members and fellows. Next slide, please. The other thing that we have as a college is our own hotel. And I think this is one of the areas where we have actually done very well. So Scott Mitchell on the left is the managing director of the estate. And we've made quite a few changes recently that I hope have demonstrated an intent to improve our environmental sustainability. So in our college hotel, you won't find a single plastic water bottle. You won't find any single-use cosmetics. And you will find a packet of wildflower seeds, which you can distribute wherever you've arrived from when you return home. And those are small steps, but again, they show a statement of intent, really. The other thing many people have commented on is how when you stay in a hotel, your room is cleaned every night, but does it actually need to be? That in itself has an environmental impact. And so as a college, we decided that we would donate a £5 sum to Cancer Research UK every time someone opted not to have their room cleaned. We've also kind of focused on our energy use and tried to introduce low energy lighting across the building. Again, that's potentially very difficult when we're in a very old building. But these are the things that are small steps, but again, show us a statement of intent that we intend to address this problem. Next slide, please. The other thing as a college and as an organisation we have a lot of use for is food. So we have a cafe, we have a hotel, we obviously have events at the Surgeons Hall, the Edinburgh Festival, weddings, lots of college events, obviously. One of the first things that we did after recent change in the catering requirements was take all our catering in-house, and it gives us much more control over it. We also put all our food waste into an anaerobic digestion system, which feeds electricity straight back into the national grid. We've also, I mean, it was one of my big bugbears really, that every time you came to the college, there was a huge amount of food, even for the smallest meeting, and it seemed excessive really. We have a catering short life working group who've made that whole thing much more efficient. And there's also been a move towards non-meat dishes, which again, it is taking things in the right direction in terms of sustainability. Despite all that, although it sounds a little hair shirts, our hotel chef has just won the Chef of the Year in Scotland, which is no mean feat. Next slide, please. And as a result of that, we were proud to have our hotel and our estate awarded a Gold Green Tourism Business Scheme Award for Scotland. So that's been recognised really, that we are one of the greenest hotels in Edinburgh. And that's certainly the case if you type that into Google and look at the TripAdvisor ratings. Next screen, please. But we also need to look at our conduct in the main business of the college. Obviously, we're not here just to run a hotel. So one of the things we've really focused on is our travel. And we've tried to make that much more efficient by having our own in-house travel arrangements, which is designed to make everything more efficient, to look for the greenest possible travel for any kind of college business, and to make sure that that's been done on a sustainable level. All our stationery is now signed off by Forest Stewardship Council, which are an organisation who help sustainable forestry. And you won't find anything in the college that's now not been accredited by that organisation. We've done other simple things like make our magazine that goes out to all the members and fellows quarterly on better and more sustainable paper in a compostable bag. And again, it's just about taking these small steps that over a period of time will hopefully have a big impact. Next slide, please. I think obviously one of the things that's been obvious to everyone is how working practices and business has changed in the light of the pandemic. And certainly as a college, I'm sure the same is true of the English College. We've radically changed how we work as an organisation. So all our council meetings, all our trainees committee meetings, all the other committee meetings, and much of the educational output of the college has been delivered online. And that obviously has a huge effect on the environmental sustainability. And this is the future, really. You know, we all have laptops, we all have mobile phones. The vast majority of us have access to Wi-Fi. There's no reason why we can't conduct business like this in future. Next slide, please. However, we also have to be mindful that as an organisation, people do require an emotional investment to continue to work with us and to want to be members of the college. And it can be difficult if we're doing everything over a computer screen to strike the right balance. One of the things we've all commented on as council members has been that we really miss the kind of human interaction that comes when you're seeing people in person. I think in the past, we'd probably gone too far towards getting everyone to Edinburgh every time we needed to have a meeting. But equally at the moment, it does feel like we're not really being particularly collegiate just because we don't have that personal interaction that goes on at either end of a meeting. The social side of things is obviously diminished. And we do have to be careful that we don't go too far. But I think the main message from this pandemic is that there is a more sustainable way of conducting our business that we have to be enthusiastic about and we have to promote. Next slide, please. As Mike mentioned at the beginning, we've recently joined the UK Health Alliance on Climate Change. And although we can be influential on the practice of surgery, this is such a huge topic that it does require a large number of health bodies to collaborate to make sure that we're all pushing in the same direction. There's no good the surgeons taking one route and the Royal College of Anaesthetists taking another and the Royal College of Nursing deciding its own thing if we're all working in the same room together. This has to be a collaborative effort, and I'm sure that Richard will touch on that in his presentation later on. Next slide, please. So what specifically can we do as colleges? So what we want to do is develop a research agenda, and we're already exploring ways of doing that. There's obviously, this is a huge topic. It's not something that has been studied in great depth before by surgeons, for surgeons, but there's definitely people out there who are interested in taking this on as an academic discipline. And I think that's something we have to get behind as the leading surgical colleges. We have to fund it, we have to be enthusiastic about it, we have to make it a valid research topic. And the only way to do that is to promote the message and be consistent in that approach. We also have a duty to pursue sustainable investments. You know, both the College of Surgeons of England and the College of Surgeons of Edinburgh have to have financial interests to ensure the viability of the college. And we have to make sure that those investments are sustainable, and that due diligence is given to all the investments that the organisations make. Ultimately, we have to be leaders. As I said at the beginning, if we don't do this, no one else is going to do it for us. And there's no better time to do it than now. But we have to show leadership. We have to be able to recommend to people what to do in their departments on a local level. And we have to educate them. And that starts right at the beginning of surgical careers. You know, we don't want people just to find themselves leading departments and not be aware of this topic and not have the knowledge and skills required to make changes. We have to offer people regular educational input and make sustainability a key component of all our educational output. Next slide, please. So I guess the key message is that collaboration is essential if we're going to crack this particular nut. It is a massive topic, and there's any number of ways in which you could approach it. We've made some steps towards sorting our own house out, and I think, you know, that will continue into the future. We do have to strike the right balance between remote working and maintaining a collegiate atmosphere. I think that's really important. But there's definitely lessons that we can learn from the current pandemic situation that we can take forward and use to make our overall sustainability much better. The reason that we were so keen to collaborate with English College is because we haven't always done that in the past, but I think this is a topic that requires that level of commitment from a group of surgeons across the country and even internationally. And I think if there's one message we can take is that things like the UK Health Alliance are essential, and we need to be fully paid up members of that and enthusiastic leaders within that group. So I hope that's given you a brief overview, and I'll pass you back to Mike.
Thanks, Dave. Great overview. And you've raised some very interesting and thorny issues, I guess. And I suppose I'd like to bring in Neil here, because Neil, we've had a lot of soul searching going on, particularly about travel. And the international travel as well as the domestic travel. And we've seen with the pandemic, all the Zoom calls. And I know, like you, that we're all probably getting a little bit sick of the flat screen, and we miss our mates and our friendships and our comradeship that we have when we meet for committee meetings. Going forward, we feel we've got to do something different, which will help the environment. What is the right balance? Have you thought about this? You must have discussed this at council.
I'm not sure we formally discussed it at council, but obviously there are discussions going on about the future of how we work in the college and with our professional membership council and so on. I think many people have actually really rather enjoyed an element of the video conferencing. Don't have to get on the train. Don't have to leave your home. It can be done when it's convenient for you in many ways. For a lot of people, I think it's actually been a very, if you like, family friendly, if I may put it that way, if you like, business. So what do we think in general terms? And again, this is a massive, if you like, oversimplification and taking much more, if you like, of what everybody thinks, and I really should. But nonetheless, I'm still going to say it, which is that I reckon we'll have a hybrid, won't we? So I think probably we are thinking ahead for our council meetings, half being face-to-face and half being hybrid. We're going to try and do a lot of our committees as video conferencing, but we'll have to have 1 or 2 a year face to face. I think this is something that's evolving, isn't it? And of course, we're not sure when the virus is going to run its course, so it may even be that we'll be video conferencing till at least next spring. Who knows? As the default position. But you're absolutely right. I think all that travel on planes. We can talk about carbon footprints a bit later, but I mean, that's really bad news. And how much of it was really necessary? Big questions to answer.
Thanks, Neil. And Stella, can I just ask you, one of the things that have been exercising us has been sustainable investments, because you know what the colleges are. They've been there for hundreds and hundreds of years, and investments have been there for hundreds, well, perhaps not hundreds of years, but many years. And some of them are perhaps less sustainable than others. And we've been looking at that as from the Edinburgh College point of view. Is that something that's occurred to you?
Absolutely, and I think it's really difficult. So I think we've now been looking at that over the last 2 years, and our current college investments are actually lower than the recommended in terms of fossil fuels. I think the challenge now is to go even lower, and the challenge with that is that there are very, very few investment portfolios at the moment that do not contain some kind of fossil fuel within it. And I think the challenge from the stock market now needs to come to us, which is how do they increase the worth of a non-fossil fuel based investment portfolio and actually attract us into investing in that, which actually will need very little attraction. But I think it's going to be something that will be a journey over the next few years. But it's certainly on our radar. And I know it's close to Vic's heart as well. I'm sure she'll talk about that too.
I think the youngsters certainly are keeping us on our toes on that one. Thanks, Stella. And I'm sure Richard will have something to say about that later. So I think we should move on to Vic. And Vic, you're going to share an English college perspective and perhaps a little bit about research, maybe.
Unmute myself. Right. So I've already been introduced, and so has Stella Veig. So I'm the a full English College Council member, but also vice chair of our Sustainability and Surgery group, and Stella Veig is our chair. And we've already talked about what it is that we want to do to focus on today. One of the two things we were talking about is splitting it in two and to try and see where you can have the biggest impact. And yes, you can have a really big impact in-house and locally. And I have to say, I'm blown away by what the hotel, your hotel in Edinburgh has done. And I think it's absolutely fantastic and amazing, and a really huge step and leading by example. I think one of the other things we can try and do, though, as colleges, not just surgical colleges, but all colleges coming together, is to try and look at what we can do on a bigger level as well. And that's the whole point in these webinars, and collaborating and coming together, and as you've already alluded to as well, where the highest carbon footprint is and where we can make the biggest impact. So one of the things, I'm just going to give you a bit of background as to why we actually set up our Sustainability and Surgery group at the English College. It was because we had a talk, some lectures by some of the leaders in their field, Miss Chantal Razan and Prof. Mood Butter. They came to the college and they gave these two lectures, and I think everybody in the room was completely amazed with the kind of data that they were presenting, and it made us all go away and rethink about what we're doing and what we can do personally, what we can do in-house, and what we can do on a bigger level. And I'll just give you a couple of slides from their talk, although you've already touched on quite a few of these things, but they work very closely with the other groups that are listed on there below, but they were really inspirational. This is one of Chantel's slides, Ms. Razan's slides. She, as you've already pointed out, highlighted for us how much the health sector contributes to greenhouse gases in the UK, and how much surgeons, therefore, personally, in the operating theatres contribute. And like you've already said, up to a third of all the hospital waste is from us in theatres, throwing away an unused harmonic, or not using reusable laparoscopic ports. And I think one of the things she really highlighted was that although when we talk about the environment and sustainability, we all think, oh, we've got a new recycling bin at the reception desk in theatres and I put my paper in there. That's not the kind of level we're talking about here. We're talking, and not recycling the paper that our scrub gown's coming. We're genuinely talking about how many laparotomy sets we open, whether we're streamlining sets properly, what we are throwing away and what we're not using properly, and what we can use as reusable things as well. So she's doing a PhD and she's done carbon footprinting and life cycles of instruments and operations. And even just like you pointed out earlier, one operation can be the same carbon footprint as thousands of miles in a car. So again, although it's absolutely brilliant that we're trying to do these small things, we need to look at what we can do in our single operation that we do every day that is contributing to greenhouse gases just immeasurably. Three of the things she's pointed out that we can do that will have major impacts are looking at our electricity usage, anaesthetic gases, which I know are slightly separate things to us. But for us, it's the consumables in surgery. What are we actually using and what can we do better? And she broke it down in this talk. And actually, if you log in and attend the next joint webinar talk that we're doing on the 9th of September with the Edinburgh College and with our college, both Miss Razan and Prof Butter will be giving their talks properly. But she's talked about how we can reduce the stuff that we're using. So are we using companies that are sending us packaging that is, when we do open our big stapler, it's in this huge plastic thing. Is that necessary? Does that company need to do that? All the extra little instruments that we ask for mid-operation for a hernia or a lap chole or something, we're opening a whole new set and then we change our mind and we don't actually need that set. That all contributes. We need to streamline things. We need to reuse things. Laparoscopic ports are now available as reusable ports, but because 15 years ago when they were tried out and they were the old type of laparoscopic reusable port and we didn't like them, we're not prepared to sometimes open our minds and think about trying them again or trying the new one. So what can we do when we get our ligger clips out and we use one ligger clip? Do we need to use that, or can we just use the one that's reusable and that's sterilizable? Are we recycling, repairing and sorting stuff out on site and doing it ourselves? That's a huge waste as well. Brighton, where I'm working at the moment, are trialling a thing in theatres for recycling our lots of instruments that are chucked away. So like the harmonic can actually be recycled and melted down and their metal and the plastic reused. So we should all be doing that as standard. But we're not. You have to like fight a battle to get this kind of thing going. But we should all as surgeons should be fighting that battle. Then Prof Butter talks about the NHS supply chain, and it was really, really interesting that basically we don't make any of our own instruments in the UK, hardly at all. 90% of our instruments are actually manufactured in Pakistan. 70% of the world's instruments are made in surgical instruments are made in Pakistan. And these are actually kids working in these factories in slave labour conditions instead of being at school. And we in the NHS are buying this. So we need to look at ourselves and take responsibility and try and drive this change. And every time we're in A&E and we open that set to do a quick suture and we don't need the 5 instruments that are in that set, we chuck them all away, even unused. That 7-year-old has made that. That 7-year-old gets injured, gets back complaints, they die of sepsis. I mean, this is our responsibility, and I feel that we need to take on this responsibility and make the changes collaboratively. So he highlighted these things. Anyway, we came away from this talk and Miss Veig and I wanted to set up this sustainability and surgery committee at the English College. So we did, and we have. And there are lots of things that we do need to achieve. And this is a table that I won't expect you to be able to see, but it basically lists all the different colleges. And there's 4 of these, and I won't put them up. And all the things that we could try to work towards achieving. And you can see that lots of us at all the colleges are not achieving anywhere near what we could be. And we've got a lot to work towards. And I know that we at the English College are trying to work towards that. And I know Edinburgh as well. And I'm sure all the other colleges, hopefully we can get on board and we can all work together. And we're all, as we've already said, a member of the UK Health Alliance. We've form these committees, and we are trying to respond to these changes, these call for changes as well. So just briefly, what are we doing? Basically, what I'm most pleased about is that we're working together. We're working with the Edinburgh College, and I hope that extends out to other colleges and other partnerships as well, and I'm sure it will do. We could include other colleges like the anaesthetists college, Royal College of Anaesthetists, and to also try and sort of endorse and promote projects. So for example, at the Future of Surgery conference in October, we're going to talk about potential projects that we can be doing, sharing data and ideas, and also to work with trainees. As we've already said, us trainees and medical students, we're the future of surgery for the next however many decades, and it's really important that we all help drive this forward and keep pursuing this. BOTA and ASSET are already part of our Sustainability in Surgery Committee at the Royal College of Surgeons of England, which is great. And we've already talked to we're already talking with the Royal College of Surgeons of Edinburgh about statements and documents and coming together to release these things together as a united front rather than as separate fronts. And I hope that if we, as the two colleges that are on this webinar tonight, are able to lead by example, then other people will want to come on board and follow suit and join us, which would be ideal. We also want to try and sort of develop a voice and get information out there, as Dave Riding touched on already. So we would like to regularly update people in our e-bulletin about where we are with sustainability and with a web page as well. And one of the things we really noticed, there was no central resource or central database to try and bring all this information together. So as you've already alluded to, all these different groups that are doing these things, actually it would just be great if we were able to work together and have this central database and then try and disseminate this information so people aren't repeating themselves or working in competition. We'd like to maybe develop an awards program as well, and promote champions in trusts, so more locally. We'd also like to, again, like I've already touched on, promote projects, and we are working with NIHR and the Centre for Sustainable Healthcare as well on projects to try and promote green surgery and what we can do. And ultimately, all of us would like to try and actually make this an integral part of the training pathway. So having e-learning modules and incorporating it into ISCP, where we are all aware of what we can and can't do and how to formally sort of take this forward as a training pathway so that we learn properly for the next however many years we're going to be surgeons. So today's webinar is to try and see what you'd like us to do, to try and engage the surgical community, ask us what you would like to see. And I've also just popped up here our email address as well for the English College for any ideas, or if you want to get in contact with any of us as well. It's a dedicated email address just for this topic alone, and it will come to us. Thank you.
Great, Vic. That really was a great presentation. Thanks very much indeed. And there were a few things that resonated with me in the old days at the start of laparoscopic surgery. And there's only one person on the panel, and that's Neil, who's my vintage, I'm afraid, and he will remember only too well that all the lap ports in those days in 1990 were reusable. And it was the companies that drove the move to disposable. And it was all on the back of, I don't know whether you remember, Neil, it was CJD, wasn't it? The risk of transmission of CJD. And it was pushed and pushed and pushed. And all the reusables disappeared. And in fact, I think most of the reusables went out to Africa and places like that, where I can tell you still most of Malawi, Rwanda, they use reusable laparoscopic ports, whereas we had moved to everything being disposable. And Neil, you will smile at this. You remember the American gun and the Russian gun, which were reusable, and you just loaded the staples to do our anastomoses. It's all gone. It's all disposable, as Vic was saying. So it all resonates about that, and I just think we've got things a little bit wrong. I don't know whether you want to comment on that, Neil. I know that you were smiling, so you can remember it all.
I remember it all very well. Of course, with the advent of chuck away stuff has come the attenuation of the appropriate people, facilities, engineers, those with expertise to, if you like, service reusable instruments. Nobody to make sure the ports aren't leaky, nobody to, if you like, clean or sharpen the scissors, etc., which has been a real tragedy. So, I mean, I think that's a huge issue that needs to be looked at, actually.
There is, of course, a cost to decontaminating and sterilising all the equipment again, which we have to recognise. But I think we just need to get facts and get more information. And as Vic was suggesting, we need the research as well. So I think we should go on to the guru, Richard Smith. And Richard, once again, thank you for joining us. And all I know is I've heard you speak a couple of times and it's inspirational. And I think there are members of this panel have all heard you on occasions as well. And so we look forward to hearing what you have to say and to get us to get up and do something about it. Richard.
Good. Well, thank you very much, Mike. And I want to begin by congratulating the two presidents on holding this webinar. And I thought they were tremendous presentations from Dave and Vicky, really showing how you're beginning to take this very seriously. I have to confess that rather to my amazement, I'm a fellow of the College of Surgeons of Edinburgh, but my biggest contribution to surgery was to give it up as quickly as I possibly could. So can I have the next slide, please? This is what I'm going to talk about. And I've got what I think is a rather, well, I can't see my own slides. Yeah, there it is. Is it coming? Next slide. So this is a picture of where I think we are now. We're immersed in the COVID pandemic, but I think the recession is going to really kick off any minute now. And then behind that, unfortunately, much closer than I think many people appreciate, is this massive wave of climate change. And unlike the other waves, it's not going to pass. It's going to be here forever. So we're going to have to fundamentally change the way we do almost everything. I mean, and I think, as Dave was saying, COVID is a wake-up call to us. And there are many debates, which I'm sure the colleges are involved in, on how should the NHS recover from the pandemic and how should our economy recover from the pandemic. And this is an opportunity to begin to be very serious about climate change. So next slide, please. This is the way I sort of like to illustrate the problem we are facing. So if we were to all live as people in North America live, if we were all to consume, that's everybody on the planet, the amount of carbon that's consumed in North America, then we would need 5 planets. We would need 5 Earths. As you've probably noticed, we have only 1. We in Western Europe don't consume quite as much carbon per head, but it's still far more than is sustainable. The only people in the world who are consuming carbon at a low enough rate to actually allow our present circumstances to be sustainable are the people in the Asia-Pacific region and in Africa. And of course, everybody is moving in this direction. People in the poorer countries want to develop, which inevitably tends to mean consuming more carbon. So how on earth can we get to net zero, which we need to do very, very quickly if we're going to avoid catastrophe? So next slide, please. So this climate crisis is a health crisis, and I think we need to make that clear every time. And it's a crisis that, one problem with that first slide I showed is this is not all in the future, this is right now. You know, there are problems being caused by floods and fires and air pollutions. There are problems right now. And in order to avoid severe climate damage and multiple deaths, hundreds of thousands of deaths, we need to keep our temperature increase to below 1.5 degrees centigrade above pre-industrial levels by 2040. We need to reach net zero. Now that's a very, very tough ask. When you think of those slides that have been shown, showing all the stuff that's being used, all of which has carbon embedded. This is a very tough thing to do. And it means that we need to reduce overall global carbon emissions by 7% a year. But actually, until this year, 2020, they were increasing by 7% every year. Some countries have managed to reduce their overall carbon footprint, like Britain, but many countries are actually increasing for the reasons I've described. This year, people are predicting that there will be a 7% drop in carbon emissions because of the pandemic. But if you think of how whole economies were effectively shut down simply to achieve a 7% drop for 1 year, it shows, I think, the scale of the challenge we're facing. Next slide, please. And just as COVID has meant changes at every single level, tackling climate change does as well. So we as individuals all need to change. Organisations, like all of the Royal Colleges that we've been discussing, needs to change. Health systems need to change. Cities need to change. Whole countries need to change. And we need to change as well at a global level. And I'll come back to this, but something I'd like to emphasise is that, of course, Britain in itself is only 1 or 2% of all global emissions of carbon. The places, so no matter how we do, we can't solve this problem alone. And the colleges, I know, have all kinds of international interactions with China, India, the US, Brazil, places that really can have a huge impact globally. Next slide, please. And you've seen this slide already, and we're delighted that both of the colleges that are here tonight are members of the Alliance. The College of Anaesthetists, we have the Association of Surgeons of Great Britain and Ireland, and of course the College of Obstetricians and Gynecologists. There's lots of surgery going on there. We have the vets involved, and the Royal College of Nursing is a member, and they have been taking a lead in many ways on reducing the use of gloves, for example. So they run a project at Great Ormond Street where they managed to halve the number of disposable gloves. There's something like 4 billion gloves a year are disposed of, and they think that could be halved. So altogether, we are 650,000 health professionals, which is a sizable chunk of the workforce of the NHS. And one of the things we would like to do as an alliance is put together a working party on net zero surgery, because it's already been clear it's going to be a very tough thing to achieve. And we've had conversations with Chantel, who Vicky was mentioning, and we have a call with Mahmood later. So, and I think bringing everybody together is, I hope, a place that we can contribute. Next, please, next slide. So we're about, I mean, the great benefit of all of this is that what is good for the planet is also good for us as individuals. Think how terrible it would be if it wasn't like that. So we're very much about cleaning up air. Air pollution is killing roughly 7 million people a year globally. We're about active lives, which is good for us. And we're about healthy diets, which essentially means much less meat and dairy and much more fruit and vegetables. It's fairly simple in many ways. Next slide, please. So why health professionals? Why should 103 people be spending this Monday evening speaking about this? Well, it is the world's major threat to health. So to ignore it would seem very bizarre. As I've just said, what's good for the planet is good for people's health. As I'll show again in a minute, health systems are themselves, well, you've shown that already, are a major source of carbon consumption. Health professionals have scientific training, so we can understand all the complicated data that's behind all of this. We are trusted more than any other groups. As the nurses always point out, the nurses are trusted more than the doctors, but nevertheless, we're much more trusted than most other groups. We have daily contacts with hundreds of millions of people globally. And I think that probably the threat to health and the positive benefits to health from a low carbon lifestyle are probably one of the best ways to reach out to citizens and motivate them to act. Because as I said at the beginning, it needs all of us as individuals to change. It can't just be done by governments. And there are huge numbers of us, so we can change ourselves and lead. And as I was saying earlier, we have these global networks. Next slide, please. You've seen some of these figures. The US health system accounts for 12% of carbon emissions, the NHS 5%. And this figure at the bottom here, that 1 in 20 vehicles on the road in the UK is related to the NHS, is perhaps initially surprising, but when you think that the NHS is in effect 10% of the economy and it's the biggest employer in Britain, that's not so surprising. So it's people going to and from work, people going to hospital appointments, ambulances, supplies being delivered. Next, please. And these are the rather disturbing data from the Lancet Countdown on Climate Change of what is happening with the carbon emissions from health systems. And you can see that mostly they're going up. Well, that's really rather crazy when this is the major threat to health in the world today, that the health systems are consuming more carbon. Next, please. Now, as I hope you're aware, the NHS in England has launched this greener NHS programme, and there is a commitment to get to net zero as quickly as possible. And I sit on the Net Zero Advisory Committee, which is chaired by Nick Watts, who was previously a director of the UK Health Alliance on Climate Change, and is currently the director of the Lancet Countdown on Climate Change, and has now been appointed as the NHS Chief Sustainability Officer. Next slide, please. And so the Net Zero Committee is trying to answer 2 questions. How quickly can the NHS get to net zero? And it's got to be something before 2045. And what needs to be done to get there. So there's a lot of detailed data being gathered at the moment. And there will be an interim report, probably by the end of this month, which will give a lot of detail, a lot of data on where carbon is being consumed at the moment. Next slide, please. This is a little bit like one of the slides that Vicky showed you, and the next one is identical. But this shows the NHS carbon footprint in very broad terms. So yes, 13% of it is travel, 15% of it is building and energy, but the vast majority of it comes from stuff. And pharmaceuticals, they're about 20% of all of the carbon footprint. But if you look there, you can see that medical instruments and equipment are a huge chunk of it. And as Vicky was making a very good point about, most of this stuff is made outside of Britain. So, and yet the NHS Net Zero programme, we've decided to include all of that. So there are going to be sort of 2 analyses: what the NHS directly controls in order to get to net zero, and what it doesn't directly control but needs to change in order for the NHS to get to net zero. Next slide, please. This shows you, by acute specialists, mental health, ambulance, where the hot spots are. And primary care and pharmaceuticals are a huge part of it. But you can see there at the back in green, acute medical instruments and equipment are a very large part of it, as you've been emphasising. Next slide, please. This is the slide that Vicky showed earlier. And just go on one more click, you'll see some. So there's some, the stuff at the top, the purple, is what needs to be done globally. For example, introducing renewable energy everywhere. There's the bit that the health sector controls itself, which includes models of care, anaesthetic gases, inhalers. And then there is, this was produced by the Sustainable Development Unit back in 2016. And you can see even then, that final line is 2050. There was a very considerable gap even then. A lot of that gap has been filled in terms of what needs to happen in order to get to net zero by the Net Zero Committee. And that stuff will be, as I said, produced fairly soon. But it's not all solved. We've got a lot of work to do. And next slide, please. And it does, crucially, it means that clinical pathways must change. And what does net zero surgery look like? Well, Tom Pearce, who's on our committee, who's an anaesthetist who's been studying all of this for a very long time, says, well, net zero surgery potentially looks like no surgery. And of course, that's not an option. So there's going to need to be a lot of very detailed work in how it's going to be possible to get to net zero. Next slide, please. In broad terms, this comes from the Centre for Sustainable Healthcare, and Chantel has been working with them. So our aim is to try and reduce carbon without reducing health. And one way is, a very powerful way is to reduce activity, to do less, through things like prevention, patient empowerment, and lean pathways. But then also we need to reduce the carbon intensity of what we're actually doing by producing low carbon alternatives and changing the way we work. And as I looked at this slide earlier, I was thinking there's a quote that I've used often, and I hope is familiar to all of you, that good surgeons know how to operate, better surgeons know when to operate, and the best surgeons know when not to operate. And someone I've been working with on other projects is Jane Blaserby, who's Professor of Surgery in Bristol. And as you know, she's very interested in, often you don't necessarily need to operate. And the minute you don't operate, that's a powerful lever in reducing carbon. Next slide, please. And I just wanted to make net zero means we reduce carbon as far as we possibly can, and then we offset, by things like planting trees and sequestering carbon in enriched soil. But you can only plant so many trees and you can only sequester so much carbon in enriched soil. And a lot of offsetting is effectively paying poorer people to make simple changes like changing light bulbs. And George Monbiot says carbon offsets are like the ancient Catholic Church's practice of selling indulgences, absolution from sins and reduced time in purgatory in return. And another analogy is drawn with adultery. So if you're keen on adultery, you pay somebody else to be faithful in order to make up for your adultery. This is not going to be the answer. And, we hope that better technology will come along to reduce carbon from the atmosphere, but we cannot rely on it. Next slide, please. So what would we like all of you organizations to do? Well, we've got a long list that we've shared, but I've picked out some of them. Declare that the climate emergency is a health emergency. It surely is. Take a menu of actions ranging from the easy, which is to talk and write about it more, through to the harder, which is disinvest from fossil fuels. And quite a few of the colleges have successfully disinvested from fossil fuels. And in fact, the College of Psychiatrists made a big saving by disinvesting. There's a good chance that fossil fuels are not a sensible place to invest now. Contribute to developing a national network of health professionals willing to speak and act on climate change. Encourage your members to reduce the environmental impact of their lifestyles. Contribute to the Greener NHS programme. I hope you both submitted evidence to the programme. There was a call for evidence. And encourage colleagues in other countries to act. Next slide, please. And for you as individuals, move better, fly less, ideally not at all, drive less, walk and cycle more, eat better, move from a high carbon diet to a low carbon diet, know what that means, buy better, use your money, divest from fossil fuels, invest in sustainable goods, and talk better. Talk about ecological degradation as a health issue rather than an environmental issue. And listen, as you're listening now, and you'll be fed up with listening for much longer. So I'm nearly finished. Next slide, please. So actually, this is my last slide. This is to show that you as an individual can make a difference. This is the effect of Greta Thunberg, who, as you know, sat alone outside the Swedish parliament, insisting that something be done about climate change. And these are flights from in Sweden. And she started just where she started in the middle there. She reduced flights before that were tending to go up by 10 or 5% month on month. After her demonstration, they were going down by 5 or 10% a month. So I challenge all of you to do something equivalent to that. Thank you very much.
Thank you, Richard. Great stuff. I love that. Move better, eat better, buy better, and talk better.
And listen better.
And yeah, And I think that really does resonate with all of us. I mean, there were lots to talk about there, and there have been, I feel I want to make sure that we get some of the questions in from our attendees. And before we concentrate on a few things that you brought up, Richard, I just wanted to bring up a little bit of a COVID-related issue. And we've had one comment saying, unfortunately, there's a lot of plastic waste with COVID. We all know that, with all the personal protection, the visors, the extra gowns, masks and everything. Should we review the optimum PPE requirements for the type of surgery just to try to reduce this now? Stella, have you looked at this at all for the English College?
Let me just come off on mute. No, we haven't. We've started looking at this. It's something that's on our radar, and it's very difficult because one is the PPE that we're using is being produced in other countries, not the UK, and that's detrimental to our. We talk about going into an economic meltdown, and yet we're not supporting our own industries to produce the PPE we need in this country. The disposal of PPE is not universal. I'm not sure what is recycled or not. And I think there are 2 or 3 questions on the Q&A. I think this is now vital that we actually look at this really rapidly. And I would assume, Richard, this is part of the conversation we'll be having on Thursday as well.
Thanks, Stella. I mean, it exercised a lot of anxiety amongst the colleges, the PPE, and the lack of it in the early days of COVID, and the lack of having enough to go round. And yeah, COVID was good for all the reasons that Richard mentioned in terms of reducing air travel, train travel, and so on. But actually, from the point of view of NHS waste, it actually increased quite significantly. So it was a double-edged sword. There were a few other questions that have been answered. There was one actually from a cardiac surgeon, really referring to some of the comments Vic made, because David O'Regan, who's a cardiothoracic surgeon, did an audit in his theatres and found that only 34% of a regular coronary artery bypass graft tray of instruments are actually used. So, 2/3 were not even used. And he tried hard to simplify the trays, but just wasn't allowed to do it. What a total waste. I mean, these are areas that we surely can do something about. Any comments, Neil? I mean, it's the same in some of the colorectal surgery.
Sorry, we lost you just there momentarily. Oh, yes, I mean, I don't have anything to add. I mean, there are lots and lots of things we can look at, including the way in which we use single-use chuck-away stuff. I think it needs a big look, and we need to be, really, really, really scrupulous about it.
Mm-hmm. And another question from Cleo here. What is the responsibility of the surgeon to promote healthy lifestyles, diet, exercise, and stopping smoking, etc., to prevent the need for energy-intensive operations? Well, that's another aspect which perhaps Richard didn't address, but having a healthier lifestyle means that you're not going to use surgery as much in the healthcare sector. A very important point, Cleo. Richard, do you want to comment?
Yeah, well, actually, it was on that list where I had from the Centre for Sustainable Healthcare. I mean, clearly prevention, that you don't actually need any surgery, is a major way. So it's not only that, perhaps you don't need to operate in some circumstances when you might otherwise consider operating. It's also that people are that good bit healthier and don't get to the stage where they need some kind of surgical intervention. I mean, that will probably be the single biggest way that we can reduce carbon consumption in surgery. Mm-hmm. And how you responded to my quote about best surgeons know when often not to operate. Do you agree with that?
I totally agree with that. It's much easier to operate than not to operate, and I know Neil will say the same. And so it's worthwhile making that point. The other thing that has come up in the questions is this idea of the ignorance that even doctors, all healthcare professionals have about what's recyclable and what's unrecyclable waste in the NHS, and that the yellow clinical waste bins are very close to the sinks in clinical areas, and what can you put into what bag, and I think that level of ignorance still persists in the NHS, and I think that it's something that perhaps we can, with all our mandatory training that we all have to do, you'd have thought that actually mandatory training of knowing what you can put into what bag might be quite useful going forward. Any thoughts?
Could I just say something about that, Mike? I mean, I'm not an expert on surgical waste, but one of the things we have decided as an alliance is that we should do everything we can to raise the carbon literacy of doctors and members of all of our organisations. So we have asked each organisation to come up with a champion who will lead on raising carbon literacy generally. And then we're talking to the Centre for Sustainable Healthcare about developing an online program to educate people on carbon literacy. But one thing everybody could do would be to read the book How Bad Are Bananas, which is rather an entertaining read that tells you about the carbon footprint of almost everything, and does include cardiac surgery, which has a very high carbon footprint.
It does, yeah. And there's another question for Stella and the trainees. As a trainee, you move hospital every year, which often leads to long daily commutes requiring driving. This is bad for health as well as CO2 emissions. Is there good evidence that moving hospital every year carries benefits to offset the environmental and social disadvantages? This is yours, Stella. It's right up your street.
It came from Cleo, and Cleo, it's a really good question. I've been reading it and pondering over it because I knew it's coming my way. So I think the Improving Surgical Training Programme has shown that a year in a hospital has a definite advantage rather than 4 monthly or 6 monthly moves. I think the conversation above that then is how big is your hospital? So if you've got a hospital that provides different styles of training, then actually 2 years within the same hospital would be very advantageous. Longer than that becomes more difficult because you talk about the best surgeons know when to operate, but I think the best surgeons also know all the different ways of operating and how to get yourselves out of trouble when you're in trouble. And you don't learn that from one trainer or one hospital. You learn that from moving. David and Vic are going to kill me, but my thought that did enter my head with that was actually one of the things that we have got from going virtual with meetings is that we are all now more efficient. I'm certainly more efficient because I'm not traveling between meetings. And there is something about trainees actually being trained in the years that they're in training, and actually that service element becoming very small. So actually the training is actually done in a shorter time frame. So it's a really good question. I'm going to take it away and think about it a bit more.
Thanks,
I don't know what anyone else thinks, Mike.
Well, I just want to get a couple more in because I want to finish on some kind of positive note and a way forward. But Ken Walker, great mate up in Inverness, does the Alliance have infographics of packages of recommendations that we can take to our procurement people? A really good question, and that's for you, Richard.
We don't have so much of that, but a lot of that will come out of this committee. Yeah. So the aim is to produce an interim report by the end of September, which has a lot of data in it. And there are more and more people working out how to measure the carbon footprint of different clinical pathways. And then there will be a final report which will say, this is what we need to do in order to get to net zero in time for COP26, which COP is the annual meeting of United Nations where people talk about climate change. And it was due to happen in Glasgow in November this year, but will now happen in November of next year, although we are going to hold a day-long meeting with WHO in November when it would have happened, which will be an electronic meeting, obviously. But that will produce a lot more detail. But I think, as both Dave and Vicky said, ultimately, when it comes to, what is the nitty-gritty detail of what we need to do within surgery to get to as low as we possibly can with carbon consumption, I mean, these are questions for you to answer. I mean, nobody else can really answer them. And of course, I'd also add that to some extent, the easy bit is saying, well, these are all the things we need to do. The really hard bit is actually making it happen.
Yeah.
There is going to have to be really very considerable change in surgical practice if we are going to reach net zero within the NHS, because as you've emphasised, surgery is a big part of the carbon footprint by 2035 or 2040 or whatever we come up with. So I think it's going to be a big challenge. In the end, a bigger challenge than COVID for surgeons.
Thanks, Richard. And I'm conscious that we're well up past our hour now, but I just want to finish with one question from Angelica. Is there a resource available to surgeons that collects information with regards to reusable instruments and products? I think this is a really good question, because it's something that perhaps the colleges can work together to try to do, because as far as I know, there is none. And we all have our views. We talked about laparoscopic reusable instruments and so on, and Vic brought that up. Dave referred to it, and Stella, you've also mentioned it. And I and Neil are old enough to know what those reusable instruments were like. And so we do need to give some direction, don't we, to procurement and about the safety issues and so on. And maybe that is one way of moving forward on instruments and disposable instruments, that we can do some audit and perhaps some research. So I think we should probably finish off now, and we've got lots more questions, and we will try to answer those and pass them on to participants and attendees after this. But I'm conscious that it's well past 8 o'clock on this bank holiday evening, and I know, looking at all these people in front of me, they're panelists, they're all starving and waiting to have a quick drink before getting back to work tomorrow. But I just want to thank David and Vic for their great presentations. Also Neil for this first joint webinar between the two colleges. Great stuff. Thanks very much. And Stella for your input too. But finally, to thank Richard for taking the time out to really illustrate just what a problem we have and how urgent it is that we act. And we give you our promise that we are right behind you, and we will do everything possible to drive this forward. So thank you all for joining us, and I wish you a lovely bank holiday evening. So cheerio. Bye-bye, everybody.